Welcome. My name is Sharon Gauthier, and you are watching Senior Moments. I have a company by the name of Patient Advocate for You. That's an independent patient advocacy nursing practice. We've been around for about 9 years now, and I live in Windsor. I've lived in Windsor for over 50 years, and decided that it would be a great opportunity to utilize WinTV to educate the population, especially the elderly population that we deal with, on matters that I knew mattered. So today I'm very fortunate to have Diane Braunschweiger, who owns a company by the name of Sensible Solutions, that's in West Hartford. Welcome, Diane.
Thank you.
So Diane is an insurance agent, but her specialty is Medicare. And I think there's so much confusion around Medicare that I thought having a show talking a little bit about Medicare, Diane, would be a great idea. And as I told you when we were having lunch, when I thought about doing the show and thought about Medicare, you were my first thought to bring you on board, because I know that's your expertise. So we had talked earlier a little bit about the fact that it's still open enrollment. So if you can tell us a little bit about what that means, open enrollment for Medicare.
Sure. The Medicare renewals for Medicare Advantage and prescription drug plans, Part D, that enrollment did end the 7th of December, but from January 1st until February 14th, anybody that enrolled in a Medicare Advantage plan and has changed their mind and wants the original Medicare's coverage back and to purchase a Medicare supplement and a Part D plan can do so until the 14th of February.
So that opportunity is out there, and I have to excuse myself for the cold and the plague that I still have with my voice. But so people have the ability now to go back to what I know as straight Medicare.
Right.
Okay. So if you can talk a little bit about what is straight Medicare and what is a Medicare supplement, is that, or Medicare Advantage?
Right. Well, with original Medicare, the logistics of it are that when you see a doctor in their office, what the doctor will do is bill original Medicare, which is administered by the Center for Medicare Services through the federal government. So the federal government is the first payer to a medical provider for Medicare services.
Okay.
And then once he gets paid on original Medicare, then he knows it's an approved charge that Medicare will pay, and he submits it to the secondary payer, which would be a Medicare supplement policy, which is a policy that is used to cover what original Medicare does not cover under the federal laws that put together original Medicare.
So for myself, for instance, my husband worked for the state of Connecticut. So up until a year ago, I had Anthem Blue Cross through the state. Then I had to sign up for Medicare. So I have straight Medicare, and then my supplement is the Anthem Blue Cross. So what you're saying is, excuse me, is that when I go to see my physician or I have something done, they would send the bill to Medicare, who would pay it, and if there was anything they didn't pay, it would then go to Blue Cross to pick up the difference.
Correct.
So for someone who doesn't have a supplement, what is their option? Like if they have straight Medicare, should they have a supplement, I guess would be the question.
Yes, it makes perfect sense to have a supplement, because Medicare, for each hospitalization in any one calendar year, the person that's admitted to the hospital would have to pay the first $1,288 of their hospital bill.
Okay.
And then if they're in the hospital for more than 60 days, up to the 90th day, then they would pay $322 a day being in the hospital. And that's per admission.
So it really benefits them to have a supplement in addition to having straight Medicare.
That's right.
So what would some of your options be for a supplement? For someone out there who says, I've signed up for Medicare, I have straight Medicare, so now what do I do to have that backup?
Well, the Medicare supplements can be purchased through, there's about 20 companies in Connecticut that offer a Medicare supplement. The plan designs are the same for each letter supplement. For example, there's a plan F as in Frank, there's a plan A as in Apple, there's a plan N as in Nancy. And those are different designs of the same coverages. In some instances, you're paying more of the bill than others of the remaining part of the bill that original Medicare does not cover. Most people choose to get a Plan F as in Frank because it covers everything that original Medicare does not cover, up to the amount that the provider's allowed to bill for.
So if you want that supplement, you'd have to go and speak to an agent
Yes,
that would know those options.
that's the easiest way to go about getting a Medicare supplement plan as an individual, yes.
So the newest supplement to Medicare in recent years has been Medicare Part D, and that is the prescription plan. So for people who, I'm fortunate enough that because I had the Blue Cross, I have Silver Script, so that pays for any medications I'm on. For someone who, stopped working for a company, doesn't really have the option of having coverage from that company, and now just has Medicare, can you talk a little bit about how Medicare Part D, as in dog, works, which covers medications?
Sure. So that is a separate policy. So you're going to have your original Medicare card that you're going to use for medical expenses, and you're going to have a company card for Medicare supplement from an insurance company, and then you would purchase a plan through an insurance company for a Part D plan for prescriptions. So you'd be carrying 3 cards with you in your wallet when you sign up for plans in this way. And then there are multiple companies that provide prescription plans. The tricky part with prescription plans is that not every company insures their drugs in the same way, meaning that in some plans they have that prescription at a higher copay than another company may have, based on the type of drug that it is and what their cost is for purchasing that drug as the insurance company.
So that particular plan, it's probably really important to sit down with an agent who's going to look at the medications that you take and look at the plans that you choose so that you're paying the least amount of money for that.
Right. Because you want to make sure that your out-of-pocket costs are as low as they can be, because in the event that you're in expensive drugs that you've been prescribed, you may go into the donut hole, and then you'll be paying more of the share of the cost of the drugs than if you don't have expensive drugs.
And a lot of people know about that donut hole that they often hit. When you talk about, excuse me, the secondary coverage again and the hospitalization, the other part that I think is important for people to understand is that it's just not the hospitalization that having that secondary is helpful with, but if you have to go to rehabilitation. So let's say you go to the hospital, you make that 3 days that you have to be there that everyone knows about under Medicare that now qualifies you to go to a rehabilitation center, which is your short-term rehab places. People don't really understand that even though that's covered by Medicare, it's not covered for the whole time that you're there. So you have 100 days.
Correct.
So it's not 100 days a year, it's 100 days with 60 days in between. Is that how that works?
Right. And so with the rehab part of it, once you go into rehabilitation, the first 20 days are paid for by Medicare.
100%.
Right.
Right.
And then the remainder of the days without a Medicare supplement, you would pay $161 a day up to the 100th day in 2017.
So it used to be, I thought, like 20%, but I think it's just a flat rate that they come up with every year. And you're saying for 2017, it's what, 100?
$161 a day for skilled nursing.
So you go into skilled nursing, let's say because you went into the hospital, you had an infection. I already know they never get anybody out of bed, so now they're going to need rehab. That's going to be a whole other show, but now they need rehab. They go to short-term rehab, and in everyone's mind, they think they have 100 days, which there is 100 days. But what people don't understand is you don't want to use those 100 days because you need them. You might need them to utilize at another time. And that when you come out, you need to have 60 days out of the hospital and rehab in order to utilize that, or how does that work? Because I'm a little confused by that.
Well, I think what you may be referring to is if you're readmitted into the hospital, it's not the rehabilitation piece of it. It's if you're hospitalized within 60 and re-hospitalized after the first hospitalization, and if you are out of the hospital for less than 60 days and you go back into the hospital, then your original deductible still applies. So if you're out of the hospital for more than 60 days, then you would have to pay your $1,288 deductible again at the hospital.
Okay.
For rehabilitation, however, once you're in the hospital, you have to make sure you stay in the hospital for 72 hours and then are transferred directly to skilled nursing for rehabilitation in order for Medicare to consent to pay for the rehabilitation. Because everybody has a story about a parent that didn't stay in the hospital
I
for 3
know.
days or went home in between, and then they decided, oh, dad really needs to go into skilled nursing, and then it's a lot more trouble to get Medicare to pay for that stay once somebody hasn't gone directly from the hospital. So once you
Or
go,
they don't get admitted,
Right.
which was a huge problem, I think, in the last couple of years, because when the hospitals got hit with Medicare saying, if someone's readmitted within 30 days, we're not going to pay you for that same issue if they go back with the same issue. What that created, I personally feel what that created, was the hospitals then looking at not admitting people at all, but putting them under observation. So I think everyone needs to understand it's really important to find out whether or not you've been admitted. Because it can look like you're admitted, you go to the unit, you've got nurses taking care of you,
Right.
and 2 days later they'll come to you and say you might need rehab and tell you that you weren't admitted. And families were wild about it. And I think that that's what changed the rules with Medicare when AARP in particular had a class action suit around admissions versus observation. And then that's when the 72 hours across the board came out. If they're there for 72 hours, they're admitted. They need to be admitted.
admitted into skilled nursing or into the hospital. And that piece I'm not familiar with.
Yeah. So what happens is they can be under observation up to 48 hours. I think that after 48 hours, they need to look at admitting them or discharging them now. And because what we're getting a lot of calls about is that people are there for 2 days and they have to go to skilled nursing, and now the families are faced with having to privately pay because they haven't had that 72 hour.
Right.
So it's still a little bit of a manipulation, I think, of the healthcare system in not wanting to admit people versus observation. I think the criteria for admission has changed a lot. But if they get 72 hours admitted, then they can go to skilled nursing for the rehabilitation. That's paid 100% by Medicare for the first 20 days.
Right. And that is an old law that's been on the books for a very long time about the 72 hours.
Correct. But not everybody was playing the game fairly, I think, in healthcare,
Well,
especially when the readmission thing came about.
Right. The readmission thing is a rather new issue that I'm not personally very well versed in.
Right. So they go to rehab and they're there for 20 days. Medicare pays 100%. And after 20 days, for 2017, they have to pay $161 a day because they're paying for room and board.
Right,
part
up
of
until
room
the
and board.
100th day, correct.
So their physical therapy, their occupational therapy, their medications, all that is still covered under Medicare. They're just paying a part of the room and board.
Right.
So
Correct.
what happens if they come out and a week later the family feels that they really shouldn't have come home yet?
Can't answer that question. I haven't had that come up.
So I know the answer to that question actually. So people that need to understand that they have a 30-day window when they leave rehab and go back into the community to go back into rehab under that same Medicare if it's not working. So I think that's a safety net a lot of people don't know about. And I actually had that happen with one of my clients, came out for 10 days, and it was clear that they did not belong at home. So they were able to go back to the same place and then Medicare did cover it under that same window for them with Medicare. So Medicare Part D prescription plans are important because they cover medications. Knowing what medications you're taking is important because those plans are really wrapped around the medications you take and the expense of them.
Correct.
So give me an example of how someone might go into the donut hole. Like when we talk about that, what does that mean?
So the way the donut hole works is at the beginning of the time that you have your prescription plan, which starts over each January, you either have an upfront deductible for your prescriptions that you yourself would be responsible for paying for if that's part of the plan.
Yeah.
For drugs that are normally in the higher tiers, the more expensive drugs. And then after that, you and the insurance company share in the cost of the drugs. So when you reach, I believe for 2017, $3,700 that you and the insurance company together has spent on your medications, at that point, then the insurance company stops paying for your medications and you're responsible for paying a percentage of the cost of the drugs while you're in the donut hole. So in the donut hole for 2017, the generic drugs you would pay 51% of the cost and 47% of the cost for name brand drugs. And with some of the pharmaceutical companies, what they have said is that we're willing to forgive 50% of the cost of those medications while the beneficiary or the person on Medicare is in the donut hole, but that amount is still being applied to the total amount that you have to reach before you come out of what's called the donut hole and go to a level called catastrophic coverage. So when you reach $4,950 for 2017, then
That
you come
you and the insurance company have paid together.
that this is past the $3,700 that you and the insurance company have shared in the cost of. Now you're in the donut hole, so that cost is continued to be added to the $4,950, and then once you get to that level of the $4,950, then you go into what's called catastrophic coverage, where now all you'll pay for the rest of the year is 5% of the cost of the drugs.
So for some people, that could be very costly. Now, does that include prescription drugs, only ones that you actually go to the pharmacy for and get, or does that include all medications that would be inclusive? For instance, if you had chemotherapy outpatient or you were inpatient and were getting medications, does that include that amount, or is that separately covered underneath that plan?
When you are an outpatient receiving medications that are administered by IVs or through injections or through pumps or some other method of infusion, then those are considered under Part B, and your original Medicare and the Medicare supplement are paying for those drugs when you're on an outpatient basis.
Okay.
Your medications are covered as part of your hospitalization while you're in the hospital.
So it's not inclusive. That has nothing to do when you're hospitalized or you're outpatient and receiving IV type of medications.
Correct.
So that's good to know. Let's talk a little bit about Medicare Part B, because you have to pay for Medicare Part B. So when you sign up for Medicare, you then have Medicare Part A, right?
Right, and Part A of Original Medicare includes inpatient hospitalization, skilled nursing, home health care, and hospice. And hospice is included under the new Medicare plans. And so Part B is all of your doctor services and your outpatient diagnostic tests, labs, physical therapy, all those other expenses that you incur when you're not in the hospital.
So for people who are concerned about paying that cost, I know it's like $120 some odd a month, I think, that you pay for Part B. Or does it depend on your income? Because that's about what I'm paying a month. Is it just a flat rate, or does it really depend on the person's income?
Well, it depends. Part B you pay for based on when you signed up for Part B. So if you signed up for it 10 years ago, 15 years ago, you get grandfathered into a lower cost of Part B than if you sign up like now in 2017. Because for this year, it's $134 a month.
Okay.
That people would pay to sign up for Part B. However, there's something called the Medicare Savings Program, which is funded by state money as part of what they call part of the Medicaid system, that will allow you to have those charges paid for if the two-person husband and wife family makes under $3,000 a month, or brings in $3,000 a month if they're retired, and $2,000 a month if it's an individual. And
That's really good to know.
And that can include working wages, because the way the formula is calculated, it's not on the full amount of the wages. So some people may think they don't qualify for it, but they actually would.
And then that helps you pay for Part B.
Right, that will pay for Part B. And if you're under a certain limit inside of the Medicare Savings Program, then you won't need a Medicare supplement plan, because all the Medicare supplement charges will be covered by Medicaid, and you'd be considered a dual eligible Medicare beneficiary.
And again, you know, I would caution people not to try to make those decisions on their own, but to try to contact someone like yourself or another agent who has an expertise in Medicare in general in order to get some of this information, because it can be very confusing.
Right. And what I would recommend, and what I do with my own clients, is that I have them meet with someone who's called a Choices Counselor at the senior center in the town where they live, because there's someone there that has direct access to the people in the Department of Social Services with the state of Connecticut that will help to get those people enrolled and follow through to make sure that they get enrolled in that dual eligible program.
So in Windsor, we are Social Services Department, which I know we are very friendly with, that they'd be able to go and talk with them to find out what benefit. Because, you know, when people ask you, do you have Medicare, they always ask you Medicare A and B. There's always a hesitation if someone doesn't have B, I find with my clients, if we're out there trying to get them appointments. And unfortunately, it impacts your care, because I have found a lot of practices, which you may not realize, but I'm finding a lot of practices are limiting the amount of Medicare patients they're taking. So I may call to try and find someone an appointment with either a new primary care physician or even a specialist, and that will be the first question out of their mouth is what insurance they have.
Right.
And if they only have Medicare and they don't have Medicare B and they don't have a supplement, my guess is they're not going to take them on as a patient, and which doesn't seem right, but it's their practice and that's what they're doing. So it impacts the person's care in the long run if they don't have that coverage, which
Right.
in the longer run is more expensive for all of us, because if in fact they don't have those coverage and they're not being seen, they're going to end up in the hospital. And you know, as I talked about last night, I was on a show in Wallingford, on their Access Television, and one of the things I talked about is the emergency department is the most expensive door to walk into in
Right.
healthcare. So an example I gave her was when she asked why, and I said, look, if you show up in the ER as a woman with belly pain, you're going to get $1 million workup. That's very expensive. Ultrasound, CAT scan, x-rays, blood work, all kinds of tests, because your belly is like this open field of issues that can happen, especially with women. If you go to your primary doctor who knows you, if you can get in to see them with belly pain, that doctor can kind of sidetrack some of those really expensive exams. First of all, by knowing you. Secondly, spending that time to find out, you know, like you and I talked about today, well, why is it that you don't feel good today? You know exactly why you didn't feel good today. But if you showed up in the ER today with those same issues, I'm a little nauseous, there would be like, you know, a large amount of money spent trying to find out what it is, when in fact your primary physician can find out the same thing, which is all under Medicare Part B. And even if I have a supplement, like Anthem Blue Cross that I have, honestly, it doesn't open up any doors for me unless I have Medicare Part B. That's what they want to know now at my age.
Right.
Medicare Part B, Medicare Part B.
I'd like to just jump in something on the Medicare Part B.
Yeah.
People that are already receiving Social Security income
Yeah.
When they turn 65, if they have been getting that income already, they will be sent their Medicare card with Part A and Part B coverage automatically, and they'll start taking the Part B premiums out of their Social Security checks. It's only people that are not receiving Social Security who either will receive a Medicare card with Part A coverage only or no Medicare card when they turn 65 and wonder why they didn't receive that. And that's because people that don't already have Social Security retirement income coming in won't have Part B automatically and will have to actually do something to sign up for it.
And that actually happened to me. So for me, when I turned 65, which I sound like I'm 80 now, but when I turned 65, I physically had to go in and sign up for Medicare A and B and start paying on Medicare B. And I'm not collecting Social Security. So you're absolutely right. If I didn't do that, I wouldn't automatically get anything.
Right.
And then if I decided to join when I was 68 or 70 when I collected, I would be penalized, correct?
That's
From
right.
the time I'm 65 to age 70.
There's a penalty for every 12 months you go without Medicare Part B once you're eligible for it at age 65 or sooner if you've already become eligible for it because of an illness.
Yeah.
And so it's a really good idea. And in fact, Hartford Courant on Sunday just had an article about this with people that did have a secondary insurance not realizing they had to sign up for Part B.
Right, right.
But if you have to sign up for Part B later because you didn't remember to do it, you only have a window to do that between January 1st and March 31st each year. And then the Part B coverage doesn't start until July 1 of that same year. So you're really limited in when you can sign up for that Medicare Part B later on.
And like I said, it's very important because even though I still have Anthem Blue Cross, the moment I turned 65, the expectation was with the state that I was going to sign up for Medicare. And if I hadn't, my Blue Cross would stop paying for anything, and I would have been left with that bill.
Right.
So
And
having that is important.
yes, they would have been waiting for the Medicare to pay the 80% of the bill after the Part B deductible, which is $183 for 2017. And then original Medicare pays 80% of your Part B charges, which are your outpatient services.
So that can be a large amount. So with the time we have left, what we didn't talk about is Medicare Part C.
Right.
So what is Medicare Part C?
Interestingly, Part C is a combination of all of the benefits you get from original Medicare, Medicare supplement, and prescription plan, all within one policy that is written through an insurance company. And the history of it is that since the Medicare supplement plans cost a couple $100 a month, there were a lot of people that needed the additional coverage beyond original Medicare but couldn't afford the Medicare supplement. And so the insurance companies created these policies that would have the beneficiary pay co-pays for services. And now when the provider sees that person, they're billing the insurance company for the claims and not the federal government. And the insurance company is actually administering the program. And the money that is coming to the insurance company to help them pay the claims comes from the Part B premiums that all of the Medicare folks are paying.
Wow. Even more confusing for people. So when people this time of year, because I know for me and my husband who is retired, we get inundated with mailings to sign up for this, sign up for that. You see the advertisements on television, and my feeling is don't trust what they're saying and don't trust what you're looking at, but talk to an expert, because you can get yourself from a plan that was a very good coverage into something that you think is better to find out that it's not very good coverage.
Right, right. And you won't know it's not very good coverage with a Part C plan until you have a catastrophic event.
Right.
And all of a sudden you're utilizing a lot more medical services than you were just from your routine visits to the doctor for antibiotics or just an annual exam or whatever.
Well, and I found out some of that when I was doing community nursing a number of years ago. And at that time, there were trucks of people, insurance people, or people out there in the community, getting the people in the community to change their Medicare to another policy. Do you remember that time? There was so much advertising going on. So I happened to have a client, a patient at the time, who had changed his Medicare to whatever it was. I don't even remember what it was. But there was so much control going on with this policy that what he actually found out, because he happened to have a wound that we were managing, that he was limited as to how much of the wound care products they would pay for this gentleman. So after a certain period of time, he no longer had any coverage for those wound care products. And that was kind of my first introduction of, oh my gosh, I can't believe that. You know, he went and changed from what he had originally that may have covered it. And he had no idea that this was the case. So some people may call that managed Medicare. So can you talk just a moment about what is considered managed Medicare versus straight Medicare?
I haven't heard the term managed Medicare. I will tell you that on a Medicare Advantage plan, that Medicare Advantage plans have to cover everything that original Medicare does.
Okay.
So there are no gaps in coverage between original Medicare and a Medicare Advantage. They're the same benefits are provided under both. Medicare Advantage plans can also offer other coverages that are not considered original Medicare, like a dental exam, an eye exam, hearing exam, hearing aids, things that original Medicare doesn't cover. But I think that, you know, we've come a long way from those first days of those Medicare Advantage plans, because there were a lot of new laws put in place that would limit agents' access to Medicare beneficiaries, and the only way they would be allowed to market to them anymore would either be by mail or by setting up a booth at a pharmacy and just have one person there that's meeting with beneficiaries, because they did try and protect people that were switching plans and not realizing that they were getting something different than what they had originally.
Yeah, and that's what I saw, because I was actually a nurse in the inner city in Hartford, and truly there were like vans of people going in and making changes for some of these residents that had no idea the changes that they were making until, like you said, they were in a crisis. So for someone who doesn't have straight Medicare, right, they still have the ability to change from whatever Medicare they have to straight Medicare.
Well, in Connecticut, you would either go into a Medicare supplement plan or you would go to a Medicare Advantage plan. There aren't other types of Medicare medical coverage in this state in particular. But between January 1st and February 14th, if someone thinks they're ready to go in, or they want to switch over and go back to original Medicare and get a Medicare supplement and a prescription plan and not have a Medicare Advantage plan anymore, or they didn't sign up for a prescription plan before December 7th, they can do so after the 1st of January.
So somebody who, you know, goes on Medicare, how did they end up getting into a Medicare Advantage plan versus just going in and signing up for Medicare? Like, how does that happen?
Well, because the marketing is only by mail now, there are many different agents from all over the country that get mailing lists of people turning 65, and so
Right.
they deluge these customers with literature
Yes.
to get in touch with them, and they show them what the premiums would be for those Medicare Advantage plans, and they look so much more desirable than a cost of a Medicare supplement plan that people are curious about what those plans cover.
So you need to be very careful before you make any changes at all.
Yes, absolutely, and it's best to speak with a certified Medicare agent.
So Diane, how long have you been in business?
I've been in business for 14 years.
Long time. Thank you for coming. The whole premise of this show has always been around educating people in basic language. Hopefully we brought that to them. But if people want to contact you, how would they do that?
The easiest way would be to go to my website for my contact information, which is info@sensiblesolutionsct.com.
And then once they get, and I know you're very honest, very upfront, which is what I admire about you and your practice. So I thank you for that. And when they go on your website, if they want to contact you, they can ask you questions, because I think people have to be very careful as they're making these decisions that impact them for at least a full year before they can make
Before
any
they
changes.
can make a change, that's correct.
So
Yes.
thank you for becoming part of our family.
Thank you.
We will have ongoing discussions, I'm sure, about Medicare. And again, I want to thank everybody for tuning in to Senior Moments on Win TV. And again, congratulating Win TV on the 35th anniversary, and we will see you next month.